vaccinations and testing, and you said, the state had set a goal for testing, and eventually we got there. I think the difference to me is that testing was an all of a sudden challenge. We didn't have testing, it was a new virus. I think with vaccines, we definitely saw this coming. What are some of the challenges we didn't or couldn't foresee on vaccines? And I'll just tack on a second closely related question. I think some of the hospitals and facilities feel that maybe they didn't get enough guidance. Can you speak to that?
Mel, there are a lot of challenges, as you probably know. I would just start by saying that we have vaccinated in 3 weeks a little bit over 115,000 individuals in Virginia. I'm happy to say that 2,000 of those have already received their second vaccination. So we're making progress, but there is no question that we need to, I think, speed the process up. We need to get more Virginians vaccinated, that's clear. The challenges, quite frankly, are challenges that are not unique to Virginia. I think if you look at the data across our country, and I speak with governors frequently, we're all facing the same challenges. And so, when we see these challenges, we have to take action. And that's why I'm here today, and that's some of the announcements that I made today. Number one, we're setting goals, and they're goals that are achievable. As I've said, we're going to make sure that no doses are not being given to patients, to Virginians. We're going to ramp up to 25,000. That's certainly our first goal. And by the way, that's supply dependent. That's one of the challenges. We need the doses. And we have a partner in Washington who will help us receive those doses. I am very close to the congressional delegation. They have been working. We need the funding, which they've been able to give us. So 25,000 is certainly our next step. And then after that, in order to get to 8.5 million Virginians vaccinated and having 2 doses of the vaccination, we're going to need to get to 50,000. And we're going to do that as soon as we can with Dr. Avula's help and continue the mechanisms that are in place. And that's what we need to do to make sure that all Virginians are vaccinated. And we'd like to do that by have all Virginians vaccinated certainly by the summertime and finally get this pandemic behind us.
Can you or somebody else speak to the level of guidance that was given to hospitals and to facilities that are rolling out the vaccine, and whether you feel that was appropriate, and maybe whether we will see more guidance and prescription for those facilities and hospitals?
You want to just sure, Dr. Carey?
The question was whether the guidance that was given to the healthcare systems initially, what has been that experience, or do we think that we need to revise that, I think is the question. And we have gotten feedback. We work through the Virginia Hospital and Healthcare Association, the VDMAC, the Virginia Disaster Medical Advisory Committee, as well as personal conversations literally every day with health systems, as well as health departments around the Commonwealth. How is it working on the ground? And again, the plan we've been working on for 10 months, but then when it hits reality and it has to be operationalized, that's where great learning occurs. And that's not a weakness, that's a strength. And one of the specific feedbacks that we got was that we had 1A, but then there was the first group with those who are in the intensive care units. Of course, the nurses and respiratory therapists and the doctors, those should be the first. It made sense, but in fact, over the last 2 or 3 weeks, they said, why don't we just have 1A and let us do all 1A at one time? And the governor's comments about that flexibility and getting shots in arms is exactly that. Do the right thing as you go through the priority list. And I'll give another example that consistent with what the governor just said, that talking with the health system this morning, some small counties, they're trying to plan an event for their healthcare workers outside of the hospital. But it's a pretty small county, and that is a relatively small group. Wouldn't it be much more efficient to look at that first part of 1B that the governor indicated, sheriffs, police, teachers, correctional officers? Couldn't they arrange an event? But that's in 1B. Are we allowed to do that? And the answer is yes, if it leads to operational efficiency and using our plan to its utmost to get the maximum number of doses in Virginians' arms. So there's an example that's not going to 1B statewide, but it's a local operational decision and that flexibility and judgment that the governor mentioned. So we are communicating that in response to what the vaccinators are telling us, that hey, we want to follow the rules, and we don't want to break them, but we want to go faster too. So that is a good example of the governor's comments around flexibility as we move forward together.
We're going to go to the phone next and then we'll come back.
Alan Suderman, Associated Press.
Hello, good afternoon. So, Governor, are you aware of any health systems not using the vaccine they received or vaccines going to waste? I mean, what's with the use it or lose it approach? It seems kind of almost aggressive in a way.
Yeah, thank you, Alan, for that. And the question is, are we aware of any doses that are not being used that are, I guess you would ask, having to be disposed of? And to date, we haven't been. But we are just making the point, Alan, that when we allocate a certain number of doses to, for example, a hospital or whatever clinic, whatever site we are using out in the community, if those doses aren't being used, then the next request is they're not going to get the number, and they're going to go elsewhere where they are being used. So it's just a plan of being more efficient. There are also, there are examples of when we set up sites, whether it be in the hospital or wherever, if the number of individuals don't show up to receive the vaccination, then we're obviously going to have doses left over. And so we don't want that to happen. And one of the points that I would make because of that is we move forward with this and get into phase 1B and then finally into the general population. I hope that everybody will follow the news, to follow the announcements, where these sites are going to be available, and really take the opportunity to be ready. And so when your time comes that you can get in, keep your appointment, get your vaccination, and then get your follow-up vaccination 3 weeks later. That is going to be very, very important. So we're going to request your help as we move forward with this. You're all going to be part of the solution.
Aside from saying hurry up to the hospitals and local health departments, what else can you do to increase the vaccination rate? And then just to follow up from yesterday on the schools conversation with Secretary of Education, what's going on there? If you plan on making any announcements about schools, can you let parents know what's going on?
Absolutely. I'm going to answer your second question first. And we have had a lot of discussion regarding educating our children. I think we all agree, whether it be our children or whether it be families or our teachers, that we want to get our children back in school. We want to do it safely and responsibly. And so we're going to move forward with that, and I will have some comments. We just wanted to really focus today on the vaccination process and how we can make that more expeditious. One of the things that I announced, though, as you probably heard today, is that teachers are going to be a top priority. We want to make sure that all teachers that are willing to receive the vaccination are able to receive that so that we can keep them, and as well as other staff members. Also looking at a lot of other things, Henry, and I don't want to get into too much detail, but our children have suffered from COVID-19, as have our families. And one of the things that we certainly are entertaining is looking at perhaps a year-round schooling for the next year, perhaps adding increased days this summer to really help our kids get caught up. So a lot of good work is going on in that regard. Again, the bottom line, we want to get our children back in school. We want to do it safely and responsibly. And I'll have more to say. The Department of Education, our Secretary of Education, our Superintendent of Public Instruction, a lot of effort has gone into this, and we'll be making further comments soon. The first question you had is, how can we encourage hospitals to be more efficient or give more doses? And I think that's one of the themes of the topic today is that, I think we've gotten off to a good start in the first 3 weeks. We've vaccinated over 115,000 individuals, but we need to do it faster. And so we're going to work with the hospitals, we're going to work with the health departments, we're going to work with the sites, the clinics out in the communities, and we really feel that we can be more expeditious and get more shots in arms. And the reason we're doing this is, and I'm committed to it, that's what will put this pandemic in the rearview mirror. And I just want to emphasize that with all the listeners, all Virginians, that we're all part of this solution, and get ready, because we're getting ready, and we're going to, as soon as we can get the doses that we need, as I mentioned, we're getting a little bit over 110,000 a week. We need more doses. We have a partner in Washington. We can use the Defense Production Act in order to provide more doses. But we're all a part of this team, and we want to get the pandemic behind us.
Bruce Potter, Inside Nova.
Good afternoon, Governor, and thank you for taking the questions. Two very specific questions for you. Number one, good goals need a timeline. What is the timeline or expectation for getting to 25,000 and then 50,000 doses a week, assuming that they are available? And then secondly, I think I heard you say, and correct me if I'm wrong, that the health department will be releasing more information, more details about where the vaccines were going to be distributed to. And I wondered if you could provide a couple more details on exactly what kind of information is going to be released there. Thank you.
No, two great questions, and I think your second question goes to when I can get the vaccine and where, and the public messaging that will go into that. And I'll let Dr. Oliver handle that and talk in a little bit more detail. The first is the question was, when will we hit 25,000 and when will we hit 50,000? And there are a lot of factors that contribute to that, and my answer would be as soon as we can. We, again, want to do this safely and responsibly. A lot of it will be supply dependent, and I think I've made that point already. But in order to get to 25,000 and especially to 50,000, we need more doses coming into Virginia, so we'll work on that. I think the other thing that I would like to say that is very encouraging, and that is the help that we've gotten at the federal level from the recent relief package that was signed by our president. And I meet with our congressional delegation usually once a week. We have a very good open line of communication, and I've told them why we need help we need, and what particular areas we need that. I proposed $90 million, for example, in our budget that the legislature will be working on just a week from now. Federally, we're receiving over $100 million. So that's going to be very helpful as we deploy this vaccination. So, and there are a lot of other things that relief package does as well. So, we're all in this together. We're getting good assistance from Washington, from our congressional delegation. So as soon as we have the doses, our plan here is to be able to ramp this up, and all this will come to fruition. So that's the plan.
I think Dr. Aller is going to talk about
Yes. I didn't mean to leave you out. I'm sorry. Thank you.
Thank you, Governor.
Thank you.
The second question related to how will the Health Department get information out for people in the Commonwealth to be able to sign up and find out when and where they can get their COVID-19 vaccination. We have more than 2,000 providers who have already been registered with CDC and are prepared to be vaccinators. We have currently well north of 120 MOUs with pharmacies across the Commonwealth so that they can provide that. Federally qualified community health centers who stand ready to become vaccinators. And so tomorrow, if we were to decide that we wanted to order vaccine and move into 1B across the Commonwealth, we could order vaccine tomorrow. It would be here on Monday, and we could begin doing that. So we are ready, and when we get to that point, we'll be able to get that information out directly to the public on our site. We are currently setting up software whereby individuals can pre-register for vaccinations. We'll be working with their community-based providers, so there'll be areas where they can go. This information will be published on our website. We'll do massive media campaign around it, social media, and other means to let people know where they can go become vaccinated. And hopefully this will be something that will be occurring in weeks.
Governor, I wonder how concerned you are about some of the higher numbers that continue to come from the state, and if you're worried about hospitalizations, and then specifically if you look at the events going on up in DC today, if you think that that could be a super spreader event.
Yeah, thank you, Greg. Two questions. Let me answer the second part of your question. I regret, it's very disappointing what is going on right now at our nation's capital, and absolutely when people are out and not using their distancing, not using masks, and obviously it can contribute to more spread of this virus. I would also make the point that I have been in touch with the mayor of Washington. Obviously we have our National Guard here in Virginia, and if there's anything that we can do to support her in that mission, we will certainly do that. As far as the numbers, Greg, they're very concerning to me. We had over 5,000 new cases today, over 30 additional deaths, and it's something that I get up and I look at that data every morning. As you know, we have put some significant mitigation measures in place. I think everybody is aware of those, the limiting the size of social gatherings, the mandate for both indoor and outdoor masks, the curfew after midnight, and we'll continue to follow those and encourage Virginians to follow those guidelines. And I think part of your question was, I think, really where the rubber meets the road, and Dr. Carey and I and our commissioner are in constant communication with our hospitals. We need to know what their capacities are, do need to know how their staffing is going, need to know whether they have shifted to eliminate or postpone elective surgery. So we have that communication on a daily basis, and if we need to take further measures to mitigate these numbers, all options on the table, and we will certainly do that.
Emily Swecker, ABC 13 News.
Hello, Governor. My question for you is, why have some other states been able to begin vaccinating the public, but that has not yet happened in Virginia? And when do you expect that to happen in the Commonwealth?
I'm sorry, other states have been able to vaccinate the public. Okay, well, I guess every state maybe does things a little bit differently, but we're obviously going to follow the procedures or the protocol that we have in place. And again, there's a lot of I think discussion and logic and reasoning behind what we're doing in Virginia. Obviously, we want to get out to the folks that are most at risk first, and those are our frontline healthcare workers and individuals that live and work in our nursing homes, and then we will expand the vaccination program from there, just as I described earlier.
Okay, just checking in. Hear you, the mask is muffled a little. So obviously, as you've mentioned, 1B and 1C are huge groups of people. So I'm wondering, has the state set guidelines for prioritizing certain professions within that group? And if you could speak a little bit more to how you're actually going to go through getting those out to people.
Do you want to address the different groups? I think We've kind of gone over those, but if you want to, yes.
And then maybe the commissioner can follow up as well. So the question was really the guiding principle of the 1B, separate than the high-risk patient group, age greater than 75, and the others that you'll see, is on frontline essential workers, those that because of where outbreaks have been, where if they do their job, they cannot socially distance. They have to be in contact with the public or each other. And then those that are in 1C, the essential worker group, also, it's the subgroup of those workers that can't do it from home. So it's not whether it's transportation workers or whatever other group you want to talk about, but if you can do it safely from your home, if you're in accounting and doing a great job socially distancing and working remotely, then that you're not in that group. You would be in the general population. So we'll be giving much more concrete guidance as we get closer to getting into 1B, and that'll be in the days ahead as to when that guidance is going to go out. And I'll ask Dr. Oliver to maybe add some additional.
Jackie, the other part of your question is how are we going to organize to
Within the census, like, did first responders expect to go before teachers, or is it going to be everybody at once? Like, how does that work?
So as the governor mentioned in his remarks, what we want to do is to follow the prioritization, because that's been well thought through by our advisory work group, our health equity work group, the Virginia Medical Advisory Council, and our medical ethicists and so on. We feel that this will help us be fair and equitable in the distribution, but we don't want it to be a roadblock to our being able to, in a very efficient manner, vaccinate as many people as we possibly can as quickly as we can. So having that framework means that, yes, you should follow the order, but if you have 2 people who are higher up in the list and there's 10 others who are down the list a little bit, and you have 20 doses, vaccinate them all, right? There should be some flexibility there for the vaccinators, and that's an important point to get across. So we want them to follow the prioritization, but there needs to be flexibility there so that they can do so in an efficient manner. We have the providers for reaching all of those people. You mentioned the numbers. A lot of that will be what we call closed points of dispensing. So you can go to where the law enforcement agency and do a vaccination clinic right there. There are other places where we'll probably wind up doing like a community kind of site. If you're doing grocery store workers or something, you may not be able to rely upon the employer to set up a closed pod. We're working on that now. We will, our local health departments and the healthcare systems are beginning to have those discussions to set these things up, because we believe that we will be moving to this phase in short order.
I'm sorry, I feel like I'm have you set prioritization yet, ordering like first responders, then childcare, then K through 12 teachers? Like, or I see what you're saying about the flexibility, but have we gotten that granular yet?
Yes, so later on today, in about 15 minutes, we will be posting the specifics on Plan 1B, Phase 1B and 1C. It will be on the website, and yes, there is a priority list for both phases.
Happy New Year to you, Andre.
Could you update us on some of your efforts to reach minorities who still say they are not going to take the vaccine? And then on sidebar, my second question is, we noticed that you've been traveling throughout the Commonwealth to assist different agencies and businesses and organizations. But Governor, there are still a number of people who are saying they can't get to a human being on the phone to file for their unemployment. They can't get calls back. So people are wondering, why wouldn't the governor put more time and energy and money into the website to help struggling Virginians?
Yeah, I'm going to have Dr. Healy come up and answer your second question, but I will entertain your first question and answer that as best I can. And that's something, Andre, that is I think the trust issue across Virginia with, receiving the vaccination. Is it effective? Is it safe? And I certainly understand the history, and I understand the question of trust there. And we dealt with a lot of that actually during the testing. And one of the things that we did to address that, one of several things, was to form our Health Equity Commission. Dr. Janice Underwood leads that. And that worked in several different areas. One, it worked to establish sites, testing sites, and we'll do the same thing with our communities, with the vaccinations. We'll be going out to the communities with mobile units. There'll also be sites out there that will be established where individuals that have the transportation will be able to get to those. So that's obviously very important to us. And then we'll continue to work with our community leaders and especially our faith leaders. They were very helpful when it came to the trust issue with testing, and we've been in contact. Janice has been in contact, and we'll continue that dialogue and ask for their assistance. as we move forward. But, you know, if you look at the numbers, Andre, you know, about 60% of the population has said they're willing to receive the vaccination. I would like to see it higher, quite frankly. So Dr. Avula and I and Dr. Carey and Dr. Holler, we'll be working on that with Dr. Underwood and the rest of our staff and community leaders to really get that message out there that, one, it's safe, and also how important it is. If we all want to get back to our near normal lives, we want to get our kids back in school, we want to get our businesses open again, and in order to do that, we've got to get this pandemic under control and get a large percentage of the population vaccinated, and so we can move forward. So we'll keep working on that.
Anna Lay, Virginia Pilot.
Oh, hey, Elena, we were going to have Dr. Healy address the unemployment. Yes. Thank you, Dr. Healy.
So the question was around unemployment insurance and the communication between the Employment Commission as well as the claimants. So in November, we were taking over 100,000 calls per week, which is an ultimate goal through our call center. We actually saw a decline in December. It was around 60,000, so there was some room, but we know there's still struggle because a lot of people call at the same time first thing in the morning. Monday, we implemented a callback feature, so now everyone can call, and that you, instead of waiting on the phone in line, that someone will call you back within that day or the next day. And so we're happy that we've moved to that. Communication, Governor Northam asked the Commissioner of the Employment Commission. We had people who are in the determination process. That means they're in that appeals adjudication process that we're not getting payments, that we move people to payments in December as well to kind of to help support them through this winter issues. And so I think that's alleviated some of the calls. A lot of times someone's in that appeals process because it's a long queue. We're not sure, like tomorrow's your hearing or it's next month. And so we're working on better technology. The governor also, in his introduced budget, put $9 million towards more customer service at the Employment Commission, as well as $5 million to improve the technology to better communicate through portals.
Thank you, Megan. I'm going to take one more question on the telephone, and then we'll wrap this up. Thank you.
All right, so we'll go to Alicia Sowers now, Virginian Pilot.
Hi, thank you. I don't think I heard it in terms of what the goal was to have all Virginians who want it vaccinated. Is that by summertime, by the end of the year? And then the second question I have is, what is the threshold that you're trying to hit before you're ready to begin expanding to the 1B priority group?
Yeah, two questions. The goal is to have everybody vaccinated by this summer, and I think if we do the math of 50,000 individuals a day, that's what will get us to that goal. And your other question, please?
What is the threshold you're trying to hit before you're ready to expand to the 1B priority group?
Yeah, no, so the second question is what are the criteria before we go from 1A to 1B, and that will essentially be the work that Dr. Avula, Dr. Carey, Dr. Aller, and I will continue to communicate with our hospitals and our long-term care facilities. When we're comfortable that the majority of those individuals have been vaccinated, we'll move to 1B, and we may do that in some areas sooner than others because, as you all know, some areas of Virginia are ahead of others. So flexibility, I think, is a good word as we move forward, and we're certainly going to be flexible and make sure that we get all of Virginia vaccinated. Thank you all so much for being with us today. I know there's a lot of news going on in our country today, but to the press, thank you all for taking the time to be with us, and to the viewers at home, we appreciate you being part of this as well, and we look forward to all working together and, as I said, get Virginia vaccinated as expeditiously and safely as we can, and getting this pandemic behind us and getting back to our near normal. So thank you all. Stay safe and healthy, and we'll look forward to being with you soon. Thank you.